Every week, we're updating the COVID-19 efforts down here in South Louisiana. Louisiana was a hotbed once the pandemic first hit the states. We get an update on our numbers every week from Director of Hospitalist Services over with Oschner and LSU, our friend, our doctor, Dr. Najy Masri here on OTB. Good morning, Doc. How are you?
Good morning, guys. How y'all doing?
Doing okay. Update on the numbers since the last time we talked?
Yeah, we're starting to flatten out. We got about 26,000 cases in Louisiana, 1,700 deaths. East Baton Rouge is almost 1,800 cases. Alexandria is about 250 cases. The good news in those spots is, unlike Jefferson and Orleans Parish, they have relatively low death rates per capita, low ventilator usage, decreased hospitalization. Later today, the governor is going to start talking about what phase one of the relaxing of the restrictions will look like. So I'm sure this will bring some sense of normalcy for people in their lives as we hopefully get people back to work, get more social interaction, get some businesses online in a new fashion. I would just caution one thing. If you go back in history and look at all previous pandemics, there's always been a second peak when the restrictions are relaxed. If you go back to the Spanish flu of 1918 that affected a third of the world's population, it was those states that lifted the restrictions the earliest that had the highest second peak. So we just need to apply the principles of our past to our future as we move forward.
Last time we talked, we were talking about testing. Has there been any updates on testing or new testing available?
Yeah, the Newsweek released a report earlier this week that about 1% of the U.S. population is tested. So that's about 13,000 people for every million. That's, again, way too low in comparison to other countries. Italy, Spain, Russia, Portugal, Switzerland all have rates of testing far surpassing what we have. So, again, the idea here is to branch out this testing, identify all individuals who are out there and infected and quarantine them. Make sure the science works. We got to be able to trust the negative. If you test negative, we need to know that you don't have the virus and you're not contagious. That's a big thing. Some new testing that's out there in addition to what we know about with the nasal swabs. The FDA last week released the first at-home coronavirus test. So that's something to keep an eye on. And we're starting here locally at our hospital and around the state and country to start doing antibody testing, which would be a blood test to see if you have the antibodies to the virus and therefore have immunity. The question really is going to be moving forward is, what does that immunity mean? Does that mean that you can't get the virus again, or can you still get it?
Yeah, it seems like we're learning new things every day. Talking to Dr. Najy Masri here on Off the Bench. And, Doc, the big concern here throughout has been overloading the infrastructure of our healthcare system, hospitals. Are these stay-at-home orders, have they borne fruit? Like, how is the load on hospitals right now in Louisiana?
Yeah, the longer we flatten the curve, the more prevention we can have of overwhelming our healthcare infrastructure. And I think we've done a pretty good job of that so far. In the hospitals, when we started with this, we were seeing about 90% of our hospital census was all COVID, and now it's starting to drop down to about maybe 50 or 60%.
Wow.
We are starting to see a lot of non-COVID medicine. Remember, people right now can't get to their doctors. They can't get their stress tests. They can't get their colonoscopies. So we're seeing a lot of people with heart attacks and strokes and GI bleeds. So we're having kind of this second wave of non-COVID medicine in the hospital setting. But certainly from a COVID standpoint, the stay-at-home has certainly worked.
What about the treatment, Doc, for COVID patients? What's the treatment for positive people with COVID been like?
It's interesting. It's evolving. It changes every day. At first, I think there's a lot of data and talk out there about the malaria drugs. There was a recent VA study that actually showed that not only those help, but they actually may be harmful. Those that are on that hydroxychloroquine actually have an increased need for ventilators, increased deaths. So we're moving away from that. We're moving to things like convalescent plasma, where we take the serum of patients who were previously infected and have antibodies and give them to other patients. We're putting people on empiric blood thinners because we're noticing that this population, because of the inflammatory state, get blood clots in their legs. They can move to their lungs. They're getting strokes and heart attacks. So we're trying to prevent that from the front end. But look, this is like a coach drawing up the plays, right? He needs the right players. And we got about 250 drugs out there being studied. And just like the Saints draft philosophy of going quality over quantity, we need time to give us the right players. We don't need 250 of them. We need a couple of them that work the right way.
Doc, something that I'm seeing a fair amount of online is almost a lot of like, see, I told you it wasn't going to be that bad, or it's not as bad as the projection said. What is your reaction when you hear people saying that we have gone overboard with these stay-at-home orders?
I think it's the classic chicken and the egg, T-Bob. I think when you look at it, it's because of the restrictions
Yeah.
that we have put in place why it's not that bad. I would be scared to think about where this would be if we were in the same situation in mid-March that we are now, if the governor hadn't employed stay at home, if we hadn't gotten serious about this. I think it was the first time I talked here, I said we were down 10 in the first quarter. Well, I'd say now we kicked the field goal to take a slight lead going into halftime, but that doesn't mean we change the street clothes in the locker room and walk outside, right? We got to keep our pads on. We got to come out in the second half and crush this COVID-19 opponent.
Every week, we always enjoy the insight. We're looking forward to the information next week. Have a safe week, Doc. Thank you.
All right, guys. You take care.
All right, there
Thank
he
you
is.
so much,
LSU
Dr. Maz.
Director of Hospitalist Services with Oschner, and with us every week here on OTB, Dr. Maz.